In Fiji, health is a major issue and concern, in particular the disease diabetes. In Fiji, a major concern, especially for their health, is the disease of diabetes. In Fiji, diabetes, heart disease, and high blood pressure are the principal causes of morbidity and mortality in the nation, overtaking that of infectious and parasitic diseases. In 2013, there were 75,640 prevalent cases, and these statistics are for 1 in 3 adults who have the disease. However, the youngest person actually recorded with diabetes in the nation is only 3 years of age, so clearly that's an issue if it's affecting children that young. It's also an issue for the nation as the demand on the healthcare system is increasing, especially the financial burden of non-communicable diseases that are preventable, such as diabetes. It's filling up the hospitals, and it's taking up a lot of the funding and stuff that the healthcare system actually gets. It's a rising threat in the nation, and evidently it needs to be addressed. One of the potential and main causes for the issue is just a lack of education within the nation. People just don't know. They don't know that, eating unhealthy and all of this stuff can actually lead to it. And this combined with the lifestyle changes in the nation, such as a decline of the traditional high-starch diet customs and increased amounts of physical inactivity that are present, are risk factors for the disease. And as well, this has led to higher levels of obesity in the nation, which is also another risk factor for diabetes as well. One of the reasons for the change in the diet is just the pricing of food within the nation. The processed food is cheaper than the healthiest stuff, so more of it is being consumed. It's convenient for people to come and get meals that are already prepared. For some people, even though they might want the healthiest stuff, it's actually not an option because of the price of it and because of the levels of poverty that in a nation, like some people actually just can't do it. So they're having to buy the cheaper and more unhealthier stuff just because of pricing. And so because of these things, clearly the issue of diabetes within the nation of Fiji needs to be addressed. A major way that this can be implemented is just by increasing the education within the population, and for this to be effective, it needs to start at the community level where it's accessible and available to everyone. It needs to start in the primary schools where kids can learn about this stuff while they're young so they don't get into bad habits while they're older. And the education that needs to be available needs to include things about seeking medical attention early if something doesn't look right, and not delaying it, as in many cases in the hospitals and people with diabetes is that they don't actually do anything about it. They start to get these diseases on their feet, and it actually leads to them having to have amputations. And in Fiji, there's 3 amputations a day taking place as a result of late diagnosed diabetes. So getting the information out there that it's okay to go to a doctor, go see what's happening, can actually prevent a lot of this stuff from happening. And then this education should also include public health messages that target and raise awareness for poor eating habits and the sedentary lifestyle, as it can actually be, like, diabetes can be prevented if information is readily available to the population and it gets through to their heads and they actually understand the things that are causing it. And it's just things like eating healthy, exercising each day, stopping smoking and lowering alcohol, and just putting that out there that it doesn't have no effect on people's body. Another potential opportunity to address this is just to improve the healthcare infrastructure of the nation and the quality of healthcare facilities, and also the number of them that are available to the public, to address the price of them as well, and also in training up healthcare professionals